We're left with an impression, we look at the statistics, that we're moving into a post-pandemic phase. You're at the sharp end. What are you seeing?
I'd say definitely in terms of the infection rates, they are dropping in comparison to last year. So essentially last year, this time last year, they were a lot higher. Obviously, we were a lot more worried about it, which is why the free testing started, things like that. But now, compared to what they were last year, obviously they are dropping, which is obviously good, positive, moving in the right direction, which is definitely what we want to see.
And in terms of, we've drawn attention repeatedly with people like Carol Sikora to the fact that actually, look, guys, don't obsess too much about rates, be far more focused on hospitalisations and therefore, as a consequence, death tolls as well. And if you look at hospitalisations, even in Scotland, where things have been really bad recently, actually the death rate is pretty, every death's a tragedy, etc. But actually, compared to where we were, we're in a much better place.
Yeah, in terms of the hospitalisation, compared to last year, last year we were, like you said before, press conference when everything was increasing, it was really bad. But now, obviously, it's still bad. Obviously, every death that we get from COVID is not, no one wants any deaths from COVID, but it is moving in the right direction, which is obviously the most important thing.
And what about, the big questions now for people when they're looking at the National Health Service, the backlog of things like elective operations, just trying to see a GP? What are you seeing? Are you having to do a lot of apologising to patients who can't see you face to face?
Well, no, yeah, it is. Unfortunately, the backlog is something that was kind of there before COVID. Obviously, because of COVID, it has gotten a lot worse. But I think, obviously, we're trying to come up with new plans in order to tackle that. Because I think the most important thing is working in the right direction and trying, obviously, with the public's help, and trying to ask for that, that kind of apologies and letting them know that obviously we are trying our best, because COVID, as you can imagine, knocked a lot of things in NHS out of sorts.